Assalamu alaikum. Welcome to the journal club of this week. This week article is titled Vitality Test for Bulb Diagnosis of Adjacent Teeth Following Sinus Floor Elevation. It's a prospective study recently published in a Clinical Oral Investigation journal in 2025 and done by a German group. The aim was to evaluate the relevance of loss of bulb vitality following various maxillary sinus augmentation techniques. It's a multi-center study, including one university and two private practices, both in Germany from 2015 to 2023. Each patient included in the study was scheduled for sinus floor augmentation, followed by implant placement and the provision of implant-supported fixed restorations, and only adjacent teeth within 1 to 2 positions, mesial and distal to the augmented site, were included in the analysis. The patients were divided into two categories based on the amount of residual bone and the surgical technique employed. Both categories underwent lateral wall sinus lift. However, a group was with 0 to 4 mm of remaining alveolar bone underwent delayed implant placement, while the 5 to 10 mm of remaining bone underwent immediate implant placement. The vitality of the adjacent teeth were checked at the day of the surgery, 2 weeks, 4 months, 8 months, and 12 months after the surgery using Cole test. For sample size calculation and due to lack of previous studies in this subject, a mean assumed incidence of 3% was assumed because of the retrospective study designed by Beck et al., which might underestimate the frequency of bulb vitality loss and the potential higher frequency of events in more invasive surgeries like Le-Fort-1 osteotomy, and a total of 205 teeth were needed to be examined. They had 158 patients with 378 teeth included in the study and were followed up to 1 year post-surgery. 2 teeth in 2 patients showed no bulb vitality before the operation, and positive results were obtained 2 weeks after sinus elevation procedure. Another 3 teeth displayed no bulb vitality post-operatively but turned positive at the 4 months follow-up, and the teeth remained vital at 1 year follow-up. The McNemar test showed there is no statistically significant difference in bulb vitality before and after sinus floor augmentation, meaning the procedure did not significantly affect the bulb vitality. In conclusion, while sinus floor elevation may lead to transient bulb vitality loss in a small percentage of cases, this effect is typically reversible within a few months.